Anger Management. Part 2. How to identify anger problems and address them. Before I proceed, I request you to stay to the end of the video and please subscribe for access of more coming videos. Let's start. How to identify anger problems and address them. Year after year, anger is becoming more prevalent in many countries in the world. In fact, in a survey conducted by Esquire magazine, half of all who responded said they were angrier than they were a year ago. 20% of Americans have diagnosable anger problems. With these statistics in mind, it makes sense to examine your thoughts and behaviors to find out if you have an anger problem, and if so, what type of anger it is and how you express it. This topic can help you explore your anger issues and decide how to address them. Is it wrong to feel angry as many people think? Anger is usually a healthy emotion. Reasonable anger can give you the energy to fight for a noble cause or hang on when times are rough. Feeling angry, then, is not wrong in and of itself. It is what you do with that feeling that can cause you problems with your work and your relationship and take the joy out of living. The way you think about and express your anger can make the difference between having a happy, fulfilling life and having a life that is out of control. Once you realize you are taking little control of your anger, you can develop new ways to think and act that lessen your overblown feelings of anger. Deciding to explore your anger problems. If anger is a problem for you, you likely already know it. Some individuals don't even realize the extent of the problem until a loved one points it out. They may find that they have trouble forming or maintaining healthy relationships. They might get into physical fights that cause themselves or others bodily injury. Their uncontrolled anger can even land them in legal trouble. 2 ways to begin exploring the nature and extent of your anger problems are: 1. To know the most common symptoms of anger, and 2. To take an anger problems test. These are simple, non-threatening tasks that can start you on the path toward effective and lifelong anger management. Anger problem symptoms. Some of the symptoms of unmanaged anger are or feel very physical. 1. A tingling sensation in your body. 2. A feeling of tightness in your chest. 3. Headaches. 4. Fatigue. 5. Sinus pressure. 6. Elevated blood pressure. Other symptoms are psychological and emotional. 1. Anger. 2. Rage. 3. Anxiety. 4. Irritability. Feeling a need to isolate yourself. Notice that what we tend to think of as anger is only one emotional symptom of the condition. Many people are surprised to find out that anxiety can come directly from an anger issue. People who are irritable may not think of themselves as angry, but simply as grumpy. If you have any of these physical or emotional symptoms, taking an anger problem quiz might be a logical first step toward freeing yourself from the intensity and pain of your angry feelings. It can also set you on the path to learning how to manage your anger better, so you can live a more productive and peaceful life. Quizzes and tests to assess your anger problem. There are 2 main types of anger problems tests. One type is a screening quiz that can help you look at your level of anger problem to decide what you should do next. The other type is administered by a professional to determine your exact anger problems and how serious they are. Self-assessment anger quizzes. A quiz that screens for anger management problems is easy to fill out and can be completed in a few short minutes. They are available online, some for free and some for a fee. You can also download free anger tests that you can print, fill out and score for yourself according to the directions given with the test. Anger quizzes typically pose fictional situations and ask you to rate how angry that situation would make you feel. Other questions might be about the behaviors you typically indulge in when you feel angry. These tests are for screening only and should not be relied on for a final judgment on whether and what kinds of anger problems you have. Clinical anger management tests. If you decide to seek help for your anger, a licensed counselor may advise you fill out a more detailed anger test to pinpoint your problem areas more accurately. The therapist may also do an interview-style test to not only hear your answers but also to observe your responses to the questions. Don't worry. They are not trying to judge you harshly. The intention is for them to get a clearer picture of how you express your anger so they can help you overcome your problems. One test which therapists often use is the State Trait Anger Expression Inventory, STAXI2. This is not a free test, but therapists typically have the test on hand to use during your first session if they choose to use it. The STAXI2 is a paper and pencil test that your therapist gives you and scores by hand. It only takes about 10 minutes to fill out the test. It is considered accurate for anyone between the ages of 16 and 63. The test has 57 questions that measure your state anger, which is the emotion feeling of being angry, and your trait anger, which is related to how anger plays a part in your personality. It measures the intensity of your anger and how often you express it. No anger problems test can give a complete picture of your anger and how it affects you and those around you. It is only one part of the assessment a therapist will use to decide what types of help to offer you. How to manage anger problems. You don't have to let anger ruin your relationships and your life. You can learn to manage your anger, so that it no longer controls your thoughts and behavior. If you believe you have anger issues and feel powerless to overcome them, help is available. Licensed counselors can help you assess your anger and develop new ways to deal with it. Here are some ways your counselor might help you practice better anger management. 1. Learn what makes you angry. A little self-examination goes a long way in overcoming anger issues. Knowing the specific types of things that make you angry can give you a chance to prepare to react differently the next time they happen. 2. Cognitive restructuring. This is simply finding a new way to think about things that make you angry. For instance, if you become enraged when someone cuts you off or block you in traffic, you might have thoughts that the person did it intentionally, that getting cut off ruined your drive, or that these things always happen to you. In cognitive restructuring, you take apart those thoughts and replace them with new thoughts of how anyone can make a mistake, how getting cut off was just one small part of your day, or how these things happen to you, as they do to everyone, only sometimes. 3. Use humor. You can use humor to relieve some of your feelings of anger. After all, many of the things that humans get angry about are absurd once you examine them in a less emotional way. Sarcasm is usually associated with anger, but silly humor can bring a smile or a laugh that diffuses your anger. 4. Get calm. You can learn to become calm and focused on practicing meditation. Let the angry thoughts pass through your mind, noticing them but not dwelling on them. It takes practice, but it is worth the effort. Another calming technique is doing a muscle relaxation exercise by tightening each muscle group individually for a short time and then releasing the tension. Spending time in nature can also be calming. 5. Take a break. You don't have to stay in an anger-provoking situation until it is resolved. You can step back and take a break from it. Typically, once out of the situation, people begin to calm down and can deal with it more constructively when they return to it. 6. Communicate anger appropriately. Anger is a part of the human experience. Yet, often people express their anger in ways that are inappropriate and ineffective. So, when you feel angry with someone, you could just say, "I am angry now," instead of calling the person names, derogating them or striking out at them physically. 7. Be assertive, not aggressive. Poor anger management often results in aggressive words and behaviors. Learn how to state your case strongly and reasonably. Expect others to treat you well. Be firm in expressing what is important to you, but be cognizant of the feelings and safety of those around you. 8. Make a plan for managing your anger. Your plan can be as detailed as it needs to be. You can identify anger-provoking situations and people and decide how you will manage your anger when you are confronted by them. Anger management is a process. No one decides to take control of their anger and becomes calm, peaceful and reasonable in one day. Practice what you have learned as well as any other techniques your counselor teaches you. Practice may not make perfect, but it can help you improve day by day. The following are the questions people ask frequently. 1. What are the signs of anger problems? We all get angry from time to time. Anger is a natural and normal response to the unpleasantries of life. Anger becomes a problem when you develop anger issues and your first response to every situation is in anger. 2. Why do I get angry easily? People who have deeper anger issues may show symptoms that indicate they have an anger management problem. Anger symptoms often present themselves when someone has unresolved anger issues they haven't been able to process. A therapist can help you understand anger issues symptoms and how to deal with them. 3. Is there a mental disorder for anger? Anger issues symptoms are a component of many other mental health disorders. People with chronic anger issues may be diagnosed with sporadic explosive disorder and other mental disorders like bipolar and post-traumatic stress disorder. 4. How can I fix my anger problem? If you have discovered you have anger issues, the first thing to know is there is help. There are options for taking anger management classes to help get your anger under control. You can also speak with a licensed therapist to learn more about anger symptoms, what is causing your anger, strategies for controlling anger and healthy techniques for expressing your anger. 5. Is there medication for anger? In most cases, angry outbursts of anger can be treated by psychotherapy and taking anger management classes for controlling anger issues. In severe cases where there is uncontrolled anger or volatile anger, the person with anger issues will be given medication for anger. People with unresolved anger are given medication when they can't understand the anger or control intensity of the anger when an anger management problem comes up. 6. What is blind rage syndrome? Blind rage syndrome is an anger management problem that happens when people don't know how to deal with anger. Instead of using healthy strategies and communication to deal with anger, some people who experience anger go into a blind rage. When someone has anger issues or anger disorders of this magnitude, they can become unreasonable, and even violent, during a fit of anger and aggression. 7. How do I stop an explosive anger? If you are having severe symptoms of anger issues, which include anger and aggression, the first thing to do is to get help from a professional advisor like a counselor or therapist who specialized in treating anger disorders. Talking to a licensed professional will help you learn to quickly identify anger issues, anger symptoms, and create healthy strategies for how to deal with anger, before your anger management problem gets out of control. 8. Can being angry kill you? Living with depression and anger can wreak havoc with your mind and body, and cause health issues with both. Living with passive anger issues can trigger cardiac activity in the heart that can be fatal under ongoing circumstances. Being angry can also cause relationship issues as you find yourself constantly on the outs due to sequences of passive anger. You may also have financial issues as a result of your passive anger management problem if you are unable to keep a job. 9. How do you relax when you're angry? You may have a hard time trying to relax if you're internally struggling with passive anger or explosive anger issues. Learning how to recognize and control your anger symptoms as soon as they come up is paramount for dealing with passive anger and explosive anger issues. 10. How do you deal with someone who is always angry? Anger is a common reason for breakups, job loss, and the ending of friendships. While expressing anger is a normal part of life, people with chronic anger issues tend to dish out more than their fair share. Other people anger as a result of trying to constantly ease or abate your anger symptoms. If you feel that your anger issues are putting you in a constant battle with the important people in your life, find out what things trigger anger in you and get help. Dealing with someone who's constantly displaying anger symptoms can turn into a toxic cycle of passive anger, anger issues, symptoms, and outbursts. These are all symptoms of anger disorders. If you're living with someone who is constantly displaying anger symptoms, talk to a therapist to learn healthy coping strategies and get an unbiased perspective. 11. What helps mood swings naturally? If you're suffering from anger issues, symptoms, and passive anger, seek medical advice to rule out any physical or mental health issues. There has been a link between menopause and anger, as well as anger effects related to mental health disorders like intermittent explosive disorder, post-traumatic stress disorder, and bipolar disorder. Anger can be suppressed or lessened by doing easy physical activities when you begin to notice anger and identify symptoms of anger starting to rise. Quick and easy ways to curb anger include 1. A brisk walk. 2. Deep breathing. 3. Exercises. And 4. Talk to therapist. Please subscribe, like and press the notification bell for more coming videos of the same topic. Thank you for your time.